Well, last week when Priyanka met officials from the United Nations Refugees Agency, their biggest concern was the lack of foreign aid, something that could eventually lead to some phasing out of critical services. But earlier this week, the United States pledged close to $300 million to agencies working for Syrian refugees, money that's needed desperately.
One of the biggest, most critical areas where aid is required is healthcare. The resurgence of polio in the region 14 years after it was eradicated is just one of several major public health issues emerging from this crisis.
A normal day at the UN Refugee Registration Center in the northern city of Tripoli. Except that every child who comes here must pass through this room for a jab, a drop and a special badge. This is ground zero of one of the biggest, most crucial public health campaigns in the world today. Ever since polio was detected in Syria last year, millions of children across the region have been at risk. It's one of the most unforeseen and tragic consequences of the Syrian Civil War, the resurgence of polio 14 years after it was eradicated in this region.
It's just 9 in the morning and already more than 150 children have already been immunized today against polio and measles right here at the Tripoli Registration Center.
This started before the news on the outbreak of polio again in Syria. However, when this was noted and it was reported that there has been cases of polio detected in Syria, again the Ministry of Public Health and UNICEF went out on a very aggressive campaign, door-to-door vaccinations. This was supported obviously by the Ministry of Education as well. There was vaccination teams going out to schools to vaccinate children, and there was also a vaccination team at the border.
Polio is just one of the many health concerns. Out of the 1 million plus Syrian refugees in Lebanon today, about 400,000 are children, a potential public health nightmare. No one can afford an outbreak of anything contagious. Health authorities and aid agencies are working overtime to ensure regular checkups, vitamin doses and vaccinations. And then there are other ways to keep the vulnerable population healthy.
Public health battles are not only fought inside hospitals. I'm at the informal settlement of Hert al-Tanak. Until some time back, there was hardly any sanitation or wastewater management over here, which means children here were more predisposed to diseases like diarrhea.
CHISP, the local NGO's efforts to provide clean drinking water here, has paid off. There are already fewer cases of diarrhea being reported. All over the country, the aim is to strengthen health access at the primary level, in the hope that it will lead to fewer hospitalizations or larger health problems. Take maternal health, for instance. The International Medical Corps managed to bring down the number of cesarean sections in hospitals by 13%, simply by giving women free health checkups during their pregnancy. In 2014 alone, more than 26,000 patients have received free or subsidized healthcare at the primary level. But that is just one part of the story. When it comes to secondary or long-term healthcare, aid agencies just don't have the money. While not enough studies have been done on how patients of chronic diseases like high BP or diabetes are coping, there are already reports of cancer patients being left untreated. It's a catch-22 situation.
It's a very tough choice. Healthcare is extremely expensive, particularly in Lebanon, which is a highly privatized system. So we really can't meet all health needs. What we've had to do is prioritize primary health care over secondary health care, because primary health care we can have a greatest impact for comparable cost. That means that for secondary health care, hospitalization, we can only treat those with emergency life-saving needs. We know that a complicated cancer treatment, for example, could cost $100,000, but for that amount of money, we could provide primary health care to 10,000 children. So these are the kind of very difficult comparisons and choices we have to make on a daily basis.
This dilemma of choice is not limited to aid workers. Everywhere I went, I saw pregnant women. In a place where birth control is freely available and advocated at the primary health centers, it seemed to defy logic. But health workers on the ground had an interesting explanation.
Women are provided with food aid if they are either pregnant or breastfeeding. And so we've noticed that it's become more difficult to provide family planning services and contraceptive methods for women because they feel that this will keep them included in receiving food packages.
As aid dries up, the desperation on the ground is increasing. Add to that the post-traumatic scars that most refugees had already carried in with them when they fled Syria, and it's a tinderbox.
In Lebanon, there was a very big mental health gap, and usually what we're trying to promote in all countries is that mental health has to be provided at the first step at the primary healthcare level. So there needs to be an integration of mental health services within PHCs in a general level within all countries. We're also treating torture victims or torture survivors. You have people that have PTSD, traumatic stress disorder. You have people, because of the stress of the environment and the fact that it's been so overcrowded with decreasing services, we're also seeing that aggression has risen amongst the population towards one another. So mothers towards their children, wives with their husbands, and so forth. And GBV, gender-based violence, is on a high.
And while more than 26,000 free mental health consultations were given to patients last year, there is an even bigger focus on community and self-help groups. Sometimes kinship and a shared story of loss is the best way to cope with one's tragedies. And then there is this group, all Syrian refugees who had to flee overnight, leaving behind their homes and lives. But today, they have found new purpose as community volunteers, taking the voice of thousands of their compatriots to the United Nations.
أنا ماني معاق عقليا، بس إنه هاي مو إعاقة، هيدي بتخليني في لسه إرادة إني أحقق كل شيء، أشتغل كل شيء.
كثير حلو إنك تقدري تساعدي الناس، كثير حلو إنك تقدري تعملي دور حتى ولو كان بسيط، بس هو بالنهاية حيكون كثير فعال.